Dr. Haas actually leads our Skinny Shot program, and we are very lucky today to have him here with us. Jerry, welcome.
Thank you. Good to be here.
The reason why we're here today is because we want to discuss everything about the Skinny Shot program. How does the Skinny Shot work? How do you lose weight with it?
So the Skinny Shot, which is really just a moniker, these are GLP-1 agonists. So they're similar to Wegovy or Ozempic or Mounjaro, but the compounds are semaglutide or tirzepatide, and these are peptide hormones that are naturally released by your own cells in your small intestine.
So they already exist in you?
They do. It's not something that's new to your body. We're just augmenting the levels of those peptide hormones that are already in your body.
My God, that's fantastic, because so it's something that already exists, that is very natural, but we're just augmenting those hormones, and that's how you start losing the weight.
Correct. And they work a couple different ways. So they work by slowing the emptying of food from your stomach so you feel fuller longer, but also they work at the brain, in the hypothalamus, in the satiety center. So they help take away that food noise, the cravings, the wanting to snack in between meals.
What's the criteria that you use? How do you say you're a great patient for our program?
Well, I would say the majority of people are potential candidates for the program. For insurance purposes, people have to meet certain criteria like a BMI of 30 or greater, or a BMI of 27 with comorbidities. But in our program, we aren't held to those numbers, and we do have people that just have 10 or 15 pounds to lose that decide to use our program.
So by saying that, and just to clarify, so it doesn't mean that you need to have like a massive weight loss, meaning that you patients that are expecting to lose 100, 120 pounds, they can be included in our program, but at the same time, someone who wants to lose 10, 15, or 20, but have reached that point in which it's very difficult for them to achieve that.
Right. I would say that our largest population group are postmenopausal women, and a lot of them are already eating really healthily. They're exercising, but they just have that 15 pounds that they're having trouble losing.
So as patients are considering out there their different options and different options for weight loss, sometimes they feel, or there's some sort of fear of like, I'm gonna go into and take this new medication. Do I have to be worried? What are the most common secondary effects or things that patients realistically would need to be concerned about the Skinny Shot?
As far as side effects?
Some sort of side effect that...
the most common thing, and it's more true with semaglutide than tirzepatide. Tirzepatide has a lot less side effects. So most of our patients use tirzepatide. But the most common things are nausea, a sense of fullness, some constipation or diarrhea is possible. But it's the minority of patients have these side effects. And usually it's just for the first day or two after the shot, which occurs weekly, that they have those side effects, and then they wane during the rest of the week.
Would you say that those are rare and overall it's a pretty benign medication?
Absolutely. I think most people tolerate it really well.
So Jerry, you know that the way we are right now, we want immediate results for everything in life, right? I mean, you click, you order something online and it has to show up in less than an hour. In terms of the weight loss process with the Skinny Shot, how soon can patients start to see that weight loss? And is it gradual, or is it in spikes, or how does that work?
Well, like all medications, there's a variety of responses. I would say there are some people that lose a lot of weight right out of the gates, the first week or two or the first month. I mean, up to 10 or 20 pounds of weight loss. But there are a lot of patients that will just lose 1 or 2 pounds a week. And that's great. That's kind of what we want to see, is slow, steady progress. And we encourage people not to be in too much of a rush, to take their time with it. And if the weight loss occurs over a period of 6 months, that's okay. That's a healthy way to lose weight.
And I fully agree with you. I would say that for patients to understand that it is a process, it's going to take a little bit of time, but it is a pathway that for sure they're going to be seeing results.
Right.
The patients, you say that they only need the Skinny Shot, or are there any other changes in their lifestyle that we recommend?
Absolutely. I think the Skinny Shot is really just a a time period for most people to reset their relationship with food. And so we really focus on encouraging people to eat more healthily, to eat proper amounts of food, to focus on exercise, eating the right ratios of protein to carbs and fat. And we have to consider, more and more that weight management is a chronic issue. It's something that we all have to deal with for the rest of our lives. So you may just be on the skinny shot for 6 months, but after that, there's a period where we might just be weaning you off of that medication, and hopefully you have reset your relationship with food during that time.
That's really good. That's great that it's one of the pieces of this entire life change for patients.
It's just helping put the wind at your back while you're trying to do the diet and exercise that we all know we need to do, but sometimes can be challenging.
So one of the questions that patients will have is, once I start the program, the skinny shot, am I going to be monitored, or am I going to get the treatment and then pretty much they're going to touch base with me in about 6 months or 3 months? Or is it going to be some sort of a gradual follow-up in which maybe the dose needs to be adjusted, or how is it?
Yeah, the platform that we use, we have a system where we are following up with the patients bi-weekly to monthly, and we're tracking their weights on a scale that's provided to them. And then the platform will tend to ratchet people up to the next dose every month, unless they're having side effects and they don't want to increase that dose. And so there is a steady increase of the dose that normally occurs as your body adjusts to that medication. So you're continuing to have weight loss during that time frame.
Great. So that means that during at least every 2 weeks, every month, there's going to be some adjustments. There are going to be contacts from our office with the patients and vice versa. The channels are open. That's what I understand.
Yes, and also if patients are having issues with side effects, constipation, nausea, we can help people get through that, and we have different medications we can use to help with that.
So one of the most important questions, I think, and that always comes up with any medication, is there any long-term side effect? Is there anything that, again, our patients need to say, oh, I'm going to be taking this medication for about 6 months or a year, and then what about down the road? Is there any risk that I have to be concerned about?
There's really not any known long-term side effects or complications with the medication. And they've done large retrospective studies. These medications have been around over 10 years, and there's no increase in any type of cancer or anything of that sort. So they really, again, they're peptide hormones that are already in your body. We're just augmenting those for a period of time. And there really aren't any long-term side effects.
The patient then starts losing weight. And then, of course, there's going to be some goals established. But how do you address when the patient starts plateauing, when they reach a steady level on their weight, and when do you determine, or how do you determine that?
So when we do our monthly check-ins, if people aren't losing weight or they do reach a plateau, that's when we discuss increasing the dose. That would be the first thing we look at doing. But we also review their diet, their alcohol consumption, their activity levels. There are supplemental medicines that we can also use along with the GLP-1s that will augment weight loss. So that's another aspect of something that we have to offer beyond just being on a GLP-1. There are other things to do that can increase weight loss.
You achieve your goals with them. They're happy. You are satisfied as their treating physician. But then it's time to come off the medication. Mm-hmm. Now they're going to go and start living their life without that shot. So how do you establish the next steps after the skinny shot?
We are developing a maintenance program, so people aren't just have to stop this medication cold at 6 months. There will be a weaning process or a maintenance dose, and that might be a shot every 2 weeks. It might be an injection every month. There's also some oral agents that we're looking at that people could use to maintain their weight after they're on our program.
I've heard about that, and probably soon we'll have some great news for our patients, right?
Yes.
As patients are losing their weight, some patients might start developing some excess skin, and that's a concern sometimes. Or they feel that they're somewhat what they call, and I've heard it this way, deflated. I'm a plastic surgeon, so if you ask me if it's okay to evaluate as a plastic surgeon a patient before the weight loss, I would say no, not before the weight loss. So if they're planning to lose some weight, an important amount of weight, then they have to lose the weight first. But from your perspective, when would you say that it's safe to refer, or it's a good idea for patients to visit with a plastic surgeon?
I think ideally, when someone gets near their ideal body weight or they're getting near their goal weight, that is the right time to see a plastic surgeon if they have issues with excess skin or skin laxity. I think in the past we've seen patients come to the OR for surgery and they weren't always at their ideal body weight, and you wish that maybe they were a little bit leaner going into it. And I think that's what led us to develop this program, is to give some people a tool to get there.
And fully agree, because they're going to get, the closer they are to that ideal weight or their ideal goal weight, the better results they're going to get.
Yes, absolutely.
If a patient is considering going on the skinny shot, why would it be a good idea to come and have it done with us at La Jolla Cosmetic? Why are we different?
I think we're just not handing out medication. So, for instance, when you come to us, we're going to check your lab work, we're going to check your thyroid function, we're going to check your glucose level, we're going to check your hemoglobin A1C. We've actually diagnosed a number of diabetics, pre-diabetics, and people that had low thyroid function. So we want to know those things before you go on a weight loss program. You get a physician evaluation, you have nursing follow-up, you have some place to call if you're having issues with side effects. We don't just give you a single dose, we're making sure that you're continuing to lose weight with increased dosing. So there's just more touch, more management, more care with our program.
Yeah, great. So it's definitely not a drive-through.
No.
Right?
No, definitely not. No, we like to pride ourselves on being a high-touch provider, and I think you have a lot of help along the way with our program.